So the Integration Council has 5 goals that they we've set for ourselves for the next several years, and ranging from the integration of mental health care to primary care to substance abuse care to individuals who have both a substance abuse problem and a mental illness problem, and also increasing the manpower in order of folks that can treat these problems.
There are several systems, services, and support services that are out in the community, but we really want to collaborate with one another to ensure that it's focused on recovery. Because it's not just about getting a service and then leaving, it's about a lifelong recovery and living a healthy lifestyle, and how are we contributing to that, and how is the community contributing to that. So what we did was working with integration councils to say that includes health, primary care, as well as mental health and substance use disorders. How do we help a person maintain a healthy lifestyle?
Well, integrated care requires a sufficient workforce, of course, but more than that, it requires a workforce with the right training and interprofessional education to do that job. And to that end, the Integration Leadership Council is working on better data than what we have right now. We need good data about what the specific needs are. We already have some great programs in the area, but we have a pipeline issue in that some of the people who have finished their didactic training have trouble getting the necessary supervised experience to achieve independent licensure. And we want to attack that pipeline when it comes to, say, internships for licensed professional counselors, or supervised experience for licensed clinical social workers, residencies for psychiatrists, or postdocs for psychologists.
So one of the initiatives is to really join forces and to see how can we come up with a common vision that we can address those issues.
We have to bring the community together to do those things, and I cannot do it alone working with Emergence. El Paso Behavioral Health can't do it alone. We're working in the area that they're working in with inpatients. So I really appreciate that they're bringing together their expertise and their passion to drive what we need here in El Paso for our population, because when someone looks up El Paso, I want them to know that the mental health temperature here is actually it's okay, that we're doing what we need to do and we're taking care of our people.